Good morning, everyone. And my topic is comparison in conventional versus capsulotomy with anterior vitrectomy in congenital cataract. And in the introduction, phacoemulsification is a well-established surgical technique for cataract removal that has revolutionized cataract surgery with its minimally invasive approach and rapid recovery time. In congenital cataract cases, the cataract is present from birth or develops early in the life, and the complexity of the surgery increases due to the altered anatomical structure and the potential for associated conditions like amblyopia and strabismus. The conventional approach may be effective for most cataract cases. However, congenital cataract often present additional changes. Recent advancements in surgical technique have introduced methods such as anterior and posterior capsulotomy combined with anterior vitrectomy. Anterior capsulotomy involves creating an opening in front part of the lens capsule to facilitate the lens extraction. In the posterior capsulotomy involves making an incision in the back part of the lens capsule to address potential posterior capsule opacification. Anterior vitrectomy, which involves the removal of the vitreous body, is employed to manage any complication or to create a clearer surgical field when the vitreous body is involved. The comparative study of these approaches aims to evaluate the efficacy, safety, and visual outcome of conventional phacoemulsification versus the combined technique of anterior and posterior capsulotomy with anterior vitrectomy. In this, the study seeks to determine whether the added complexity of the combined approach offers significant advantages over the conventional method in terms of visual acuity, surgical complication, and overall patient's recovery. And the aims and objective to evaluate comparison, complication, and visual outcome of the lensectomy and with anterior vitrectomy and conventional method in the surgical management of congenital cataract. In the material and method, the inclusion criteria are children with less than 12 years of age, children with congenital cataract without posterior segment involvement, children of both consanguineous and non-consanguineous parents, and in the exclusion criteria are children with age more than 12 years, children with congenital cataract with posterior segment involvement. In the result, in the age and sex distribution, most commonly age were involved 5 to 8 years, and there was male predominance. In the laterality of the cases, 70% cases were the bilateral and 30% cases were unilateral. And in the type of incidence of the associated ocular congenital anomalies, most commonly was present nystagmus followed by the strabismus. And the type of cataract, total cataract was present in the 7 cases. Membranous cataract was present in 1 case, and incomplete cataract was the 25 cases. In the type of operation, in conventional method, 7 cases were done with the decision, and in 6 cases with decision and aspiration. And lensectomy and vitrectomy, limbal approach was done in the 16 cases, and pars plana approach in 4 cases. In the final visual acuity, 6 by 18 or better, most of the cases with their better visual acuity, and the relationship between age and the operational visual field, final visual vision obtained, age more than 4 years have better visual outcome. In the relationship between type of operation and final visual outcome, lensectomy and vitrectomy has a better visual outcome comparison to conventional method. And the number of complication, most common complication was posterior capsule opacification. In the conclusion, though no sex predilection has been reported in the congenital cataract, in this male preponderance was observed with highest incidence is age group of 4 to 8 years. Being a comparative study, 39.3% cases treated by conventional method and 60.7% cases managed by lensectomy and anterior vitrectomy. The visual acuity was compared amongst the patient managed by conventional method. 37.5% had good vision, 12.5% had fair vision, and 50% cases had poor vision. In the lensectomy and anterior vitrectomy treated groups, 61.1% cases had good vision, 22.2% had fair vision, and only 16.7% had poor vision. And the total incidence of complication encountered was 66.6% in 16 out of 33 eyes, in which conventionally treated group showed in the incidence of 32.4% as compared to the 4.4% in lensectomy and anterior vitrectomy treated group. Thank you.
Yeah, very elaborative presentation. Definitely the incidence of PCO is more with the congenital cataracts. That's why we need the anterior vitrectomy also with. So, any suggestions?
I think the key point of your presentation was all the age group was beyond 4 years. So you did not think of doing capsulotomy and anterior vitrectomy. Did you do it with the capsulotomy?
Ma'am,
Posterior capsulotomy?
Yes, ma'am, posterior capsulotomy.
And anterior vitrectomy through the anterior route or the pars plana route, as you said.
Limbal route.
Okay. So when you're talking about PCO occurring despite this, so you're talking about PCO in general, or talking about cases where you had done the, sort of PPC and still you were having PCO in the surrounding?
PCO in general.
In general.
In all cases, yes.
So you have not, done a group analysis like those we did the posterior capsulotomy and how many of them actually had this visual problem because of PCO. That you didn't. Okay. Otherwise, the usual practice actually, it's a usual clinical practice to be doing this, definitely. So up to what age group did you actually do the posterior capsulotomy?
Ma'am, in my cases, all were less than 12-year age group.
Less than 12. So you went for posterior capsulotomy, randomized, and went for posterior capsulotomy in all cases. Okay.